Hello, hardworking humans, and welcome back to the show that takes the things you are already feeling and gives them a biological explanation that is considerably more useful than self blame. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has spent more time than she can count sitting across from people who are doing everything right and still feeling like their body is not listening. Dr. Lazuk is not with us today because she is currently at a sports medicine and body composition research summit in Sao Paulo, Brazil, having accepted an invitation to present on what she described as the intersection of neuromuscular adaptation, collagen remodeling, and non-invasive body contouring technology. She delivered her presentation on day one. It generated what the organizers are calling the most practically useful discussion we have had in 3 years of this conference. She has since agreed to review two unpublished studies on RF-induced collagen response, moderate a panel on body sculpting outcomes versus patient expectations, and apparently redesign the summit's entire closing session because she felt the original framing was missing the most important point. She has been given full creative control. We are not surprised. We have sent snacks. We await her return without expectation of a specific date. So, you have the avatar, and today we are talking about something that Dr. Lazuk hears described constantly in clinic in a way that breaks her heart a little every time. People come in frustrated, but they do not always know how to say it out loud. So instead, they say things like, I have been eating better. I have been moving more. I have been consistent. I have been doing everything I was told would work. And yet there are parts of my body that feel frozen in time, not responding, not shifting, not reflecting the effort I am putting in. And then, almost always, comes the part that Dr. Lazuk considers the most important moment in the conversation. They turn inward. They start blaming themselves. They assume they are missing discipline or motivation or willpower. They frame it as a personal failure rather than a biological reality. Here is what she needs you to hear clearly. What they are experiencing very often has nothing to do with effort at all. It is biology. There are times when the body reaches a plateau where certain tissues simply stop responding the way they used to. Fat becomes more resistant in specific areas. Muscle engagement weakens in precisely the places where you most want definition. Skin does not tighten with the same ease it once did. This does not mean something is wrong with you. It means your body has changed, and it is asking for a different kind of support than the kind you have been giving it. This is where RF plus HIEMT becomes relevant, and also where it is most frequently misunderstood. Body sculpting has been marketed for years as primarily a fat problem. Freeze it, melt it, remove it. But fat reduction alone rarely creates the shape people are actually hoping for. Shape comes from structure, and structure comes from muscle tone, skin quality, and how those layers interact with each other. When fat is reduced without addressing muscle or collagen, the result can feel incomplete. Smaller perhaps, but not stronger, not more defined, not truly sculpted. The silhouette changes, but does not quite arrive at what the person was imagining when they started. What Dr. Lazuk values about RF plus HIEMT is that it does not treat the body as a single layer. It acknowledges that fat, muscle, and skin all matter, and that they need to be addressed together for the result to look natural and feel right. Here is how it works. The radiofrequency component gently warms the deeper tissues, supporting fat reduction while simultaneously stimulating collagen in the skin above. That collagen response matters more than most people realize because it is what helps skin look firm and toned rather than deflated as changes occur underneath it. This is the detail that separates outcomes that look intentional from outcomes that look incomplete. At the same time, the HIEMT technology, high-intensity electromagnetic muscle training, activates muscles in a way that voluntary movement simply cannot replicate. These are deep, intense contractions that force the muscle to adapt and strengthen at a level that even dedicated exercise rarely reaches in specific areas. Many people describe it as their core waking up again, even before any visible changes appear in the mirror. What most people notice first is not weight loss, it is a sensation. Posture feels different. The core feels engaged in a new way. The body feels more solid. Clothes fit differently, not necessarily because the number changed, but because the structure underneath changed. There is a sense of something returning that had quietly gone missing. Then, over the weeks that follow, the visual changes begin to settle in. Areas that felt stubbornly stuck start to show definition. The silhouette looks more intentional. Skin texture often continues improving as collagen rebuilds. The results do not announce themselves dramatically. They integrate, quietly, progressively. This matters particularly right now because people are genuinely tired of extremes. Extreme dieting, extreme workout commitments, extreme promises that do not align with real life. Most people are not looking for a transformation that disrupts everything they have built. They want progress that fits into the life they already have, that reflects the effort they are already making. Which is exactly why Dr. Lazuk is also going to be direct about what this is not. RF plus HIEMT is not a replacement for healthy habits. It works best when someone is already doing their part and needs support in the specific areas where the body is resisting change. It is a partnership with a lifestyle that is already moving in the right direction, not a substitute for one. It is also not for everyone. Certain medical conditions, implanted devices, and pregnancy make this treatment inappropriate. Non-invasive does not mean automatic. A proper evaluation always comes first, and that evaluation determines candidacy before anything else. The people who tend to find this treatment most satisfying are those who are close to their goal but feel stuck. People who are active and health conscious and realistic about what they are asking for, people seeking definition and firmness without surgery, significant downtime, or dramatic intervention, and perhaps most importantly, people who are not trying to look like someone else. Most people are simply trying to feel like themselves again, stronger, more defined, more aligned with the effort they are already making every single day. When a treatment supports the body instead of fighting it, confidence tends to follow, not loudly, not dramatically, but genuinely. And that is always the goal. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, a treatment recommendation, or a clinical assessment of your individual body composition, health history, or candidacy for any procedure. RF plus HIEMT and all body contouring treatments require professional evaluation by a licensed provider who can assess your specific situation before any recommendation is made. Please consult a qualified physician for personalized guidance. Dr. Lazuk and our team at Lazuk Esthetics in Alpharetta are available to discuss whether this approach is right for you. Dr. Lazuk will return from Sao Paulo as soon as the summit closing session meets her standards, which based on current trajectory may take a few more days. May your skin always glow as brightly as your smile.